My name is Anil Rustgi. I'm the Chief of Gastroenterology at the University of Pennsylvania. My research and clinical interests are related to pancreatic cancer. From a research viewpoint, our group is interested in the initiation, progression, and spread of pancreatic cancer and what are the underlying mechanisms. And from a clinical viewpoint, I'm heavily immersed in the identification and characterization of patients and their family members who are at increased risk for pancreatic cancer and who might be then amenable to genetic testing and genetic counseling. A question that I'm often asked in this context is, how do I as a patient identify whether I might be at high risk for pancreatic cancer? To that end, it's very important to take stock of one's family history to see if there's a pattern of pancreatic cancer that's present in more than one family member, either on the mother's side or the father's side, occasionally or rarely on both sides. So the number of family members affected with pancreatic cancer. Secondly, the number of family members who might have other types of cancer, because sometimes pancreatic cancer may be associated with other cancers. And finally, age of onset. The earlier the onset, the more troublesome it might be or can be, especially before roughly the age of 60. And so armed with that type of information, then one's risk might no longer be average risk, which is age-related. The mean age of pancreatic cancer in the general population is in the late 60s. But in the setting of an appropriate family history and early onset in age of pancreatic cancer, then that risk may indeed be more than average risk to moderate and high risk. So at the core of this answer is that details and patterns can be gleaned from a close evaluation of the family history. Now, in trying to get a family history, it's a little bit like detective work, asking one's parents and grandparents about the possibility if anyone had pancreatic cancer in terms of the extended family. It's important to see if records can be obtained. Sometimes people will say, well, this relative of mine had stomach cancer, but it may not actually be stomach cancer, it may be another type of cancer. So it's really critical to get as much information as about one's family history and put that in the context of whether there may be a higher risk for pancreatic cancer in oneself.